Hi, I'm Dr. Chris Taylor. Do bladder or bowel control problems keep you from going places or doing things that you like? Are you always looking for a bathroom? Do you have to go too often during the day or have to wake up multiple times at night? Do you get a sudden or strong urge to urinate, then have to rush to get there, or even worse, not make it in time? If so, you're not alone. You may be suffering from overactive bladder. What if I told you that a simple procedure that doesn't require major surgery or significant downtime could provide relief for both bladder and bowel control problems? I'm speaking about an FDA-approved technology that's been proven in clinical trials to be superior to overactive bladder medications. This advanced therapy has improved our ability to treat overactive bladder and has helped over 80% of my patients see significant improvement of symptoms. Our practice is the #1 provider of this therapy in the country. No one in the world has treated more patients with it. We have a Medicare certified ambulatory surgical suite right in our facility. And our expertise draws visiting physicians from around the country to train with us. This same level of care and experience inspires patients to travel to our clinic from hundreds of miles away. Now it's important to know, I'm not the only physician who provides advanced therapies to treat bladder and bowel control problems. You probably have very good urologists, gynecologists, or even colorectal surgeons locally who can treat these conditions. However, women like you travel from across the country to see us because, for whatever reason, they aren't getting the attention or the help they deserve. You know, a recent study looked at patients seeking care for overactive bladder symptoms. Over 60% didn't return for their second visit. Over 80% didn't return for their third visit, and only 3% of patients made it through to advanced therapies. So what sets us apart from these other practices? Our entire practice focused on one thing: helping women find relief from their bladder and bowel control problems. We don't treat men, we don't treat cancer, and we don't deliver babies. What we do is help women like you regain control of your life. Imagine living life to its fullest again, enjoying things that you maybe thought were no longer possible, like taking your grandkids to the park, eating out with friends, sitting through a movie, or just enjoying a good night's sleep again. You no longer have to be a prisoner to the fear, anxiety, or embarrassment. You no longer have to live with these life-controlling symptoms. Best of all, your world won't revolve around the bathroom anymore. I'd love to help you find relief and hope you come see me real soon.
I heard about Dr. Taylor through a card advertising a seminar. And since I've had an incontinence problem for so long, I wanted to attend. I did, and was more than happy with what I heard. I was not able to sleep, like every hour on the hour. My world was shrinking because of it. I was getting where I had the time when I went to the store. I could go shopping for about an hour and then make it home. But like I said, my world was just getting smaller and smaller.
I do my dishes by hand. I would go to wash my dishes, turn on the faucet, and immediately I'd have to go, and I wouldn't make it. Sometimes I'd have to change clothes 3 times a day or something like that. And at night, I was getting up like 3 or 4 times during the night and still sometimes not making it to the bathroom. So it wasn't a very pleasant existence.
I was suffering. That's the word I can use, suffering. And I felt like a prisoner, because when you can't make it, you know, to relieve yourself the way you're supposed to, it's just something awful about that. That's no way to live. I would be up all night running to the bathroom like every 2 hours or maybe more. I can remember getting up at least 6 times when I laid down at night, and it was so uncomfortable. And even when I got up, I couldn't hold my water to get to the bathroom, so I'm losing it before I even got there. From the bed to the bathroom, and my apartment is a small apartment, but I couldn't make it.
Seconds before I had to go to the bathroom, I would feel like I had to go right then. And I didn't have much time to make it. I would have embarrassing accidents, no matter where I was, at home or grocery store. But then it started getting so frequent that I didn't want to leave the house. It was a chore to have to go grocery shopping. I didn't want to go to the other end of the store away from the bathroom, or go shopping with my friends, or heaven forbid go to a movie because I knew I'd miss half of it.
I was even ashamed to go to church sometimes because, you know, if I was having an episode that I was going a lot, I couldn't sit in church all the way through the preacher, you know, so I just wouldn't go. We'd go out to eat and I'll have to go to the bathroom 3 times. You know, that's embarrassing. I would be in the yard working in my garden, and all of a sudden, I was voiding down my britches.
I was in the bed. I couldn't drive. I couldn't go get my groceries. Couldn't pick up my medicine, and barely could function.
My practice is located in Harrison, Arkansas, about 30 minutes south of Branson, Missouri. We see patients from hundreds of miles away, so we understand. For some patients, transportation can be an issue. One of the biggest barriers for access to medical care is lack of transportation, which can prevent patients from seeking needed medical attention or from seeing the physician of their choice. I have a 92-year-old patient named Mary, who I've been seeing for over 15 years. A few years back, Mary missed several of her appointments. I learned that she had had a minor car accident and was no longer able to drive. Miss Mary lives just 2 miles from my office, yet couldn't see me because she didn't have access to transportation. To me, that just wasn't acceptable. So now we pick Miss Mary up for all of her appointments. Her story has inspired us to create a program that provides transportation to any of our patients who need it. Whether you live 2 miles away or 200, we'll pick you up, bring you to your office visit, and take you home. Now, we're required to charge a small fee for this service, and my nurses can let you know what we charge for your area. But please remember, if you're my patient, or if you've decided that you want to be my patient, we can help you get access to the care you deserve. The 2 most common types of bladder problems we treat are stress incontinence and overactive bladder. Stress incontinence occurs when there's an increased pressure on the bladder as a result of a cough or sneeze or physical activity such as lifting. Stress incontinence is typically due to weakened or damaged pelvic floor muscles. Now, we correct stress incontinence with a 20-minute outpatient procedure called a mini sling. Overactive bladder is caused by an uncontrollable contraction of the bladder. Patients with overactive bladder may experience frequency of urination during the day. They may get up during the night more than once, or have a sudden strong desire to urinate, making it difficult to reach the restroom in time. Treatment options include lifestyle changes, medications, and advanced therapies. Lifestyle changes are things that you can do that may help, like limiting your fluids or caffeine intake, performing exercises to strengthen those weakened pelvic floor muscles, and keeping your bladder empty or wearing absorbent pads to limit or hide embarrassing accidents. After lifestyle changes, the next step is typically medications. Now, we've relied upon medications for years to treat overactive bladder. Unfortunately, we just don't see as much success with them as we would like. In fact, a recent study showed that over 80% of patients taking these medications stop taking them during the first year. Now, most of my patients that I see have attempted some form of lifestyle changes. They're tired of medications that just don't work well or have bothersome side effects, and they're looking for a better long-term solution. So let's talk about what I think works best: advanced therapies. Now, there's 3 advanced therapies to consider. They include sacral nerve stimulation therapy called InterStim, medicines that are injected directly into the bladder, such as Botox, and tibial nerve stimulation. Clinical trials have shown that Botox and tibial nerve stimulation are no more effective than oral medications. So our practice focuses on InterStim, the only therapy that's been shown to be superior to medications. So let's look at how InterStim works. To understand how this therapy works, I believe it helps to understand how the normal bladder functions. As the normal bladder fills up, it sends a little nerve signal to the brain telling you it's getting full. Once in the restroom, seated, and ready to empty, the brain sends a bigger signal to the bladder telling it to empty. The bladder contracts, and almost like squeezing a balloon, the normal bladder empties. Now, for some patients, as the bladder begins to fill, it's already telling the brain that it's full. The brain doesn't give you time to get there before it tells your bladder to go ahead and empty. This overactivity of nerve signals results in the miscommunication between the bladder and the brain. And this is the source of overactive bladder symptoms. The closer you get, the stronger the signal or the contraction, and the stronger the urge. Now, overactive bladder medications and Botox injections into the bladder work on the bladder muscle itself to prevent or slow these abnormal bladder contractions. And for some patients, these therapies work just fine. Unfortunately, they don't treat the underlying source of the problem, which again is that miscommunication or overactivity of nerve signals. Let me describe this miscommunication another way. I have some hearing loss. If my wife and I are having dinner in a loud restaurant, I have difficulty hearing her. The background noise interferes with our ability to communicate. Get rid of the background noise, I can hear her just fine. This therapy works by delivering a small electrical impulse that blocks out those inappropriate nerve signals, getting rid of the background noise, letting your bladder talk to your brain without that interference, thereby restoring that normal communication. And it's thought to work the same way for bowel control. Now, the most remarkable part is that we can first do a quick test to figure out if this therapy may work for you long term. The test can be done in about 5 minutes. It's done in our clinic, and it allows you to test drive the therapy for 3 or 4 days to see if it works for you. And the test itself is quick and easy. Remember, those little nerves that control your bladder and bowel function live down next to the tip of the tailbone, well below your spine, and easy to get to. I look at your tailbone under x-ray, and I watch myself precisely place 2 little hair-like wires right next to those nerves. No incisions are required. We give you a little numbing medication. I place the little wires just underneath the skin, and then we tape them to your backside. We connect those wires to a small stimulator that you wear on an elastic belt for 3 or 4 days. If your symptoms improve by at least 50% or more during the test period, well, it's likely that you will do well with the long-term therapy. About 80% of our patients see significant improvement during the test and move forward with the long-term therapy. The long-term therapy is delivered by a small battery and wire, similar to the heart pacemaker, implanted just underneath the skin. It's about a 20 or 30 minute outpatient procedure, and we do it right in our surgical suite. We use local anesthetic and just a little IV sedation, so you're comfortable, but you don't have to go completely asleep. The long-term wire is placed in the exact same place that the temporary wire was located, again, right next to those little nerves that live down by the tailbone. The small battery is placed about an inch or so underneath the skin in the upper part of the buttocks, below your belt line, but above where you sit. That's it. A small battery and wire. Everything's hidden underneath the skin. No one knows it's there. And it helps you get long-term relief from your bladder and bowel symptoms. Since it's outpatient, and we do it right in our facility, you go home within an hour or so with minimal recovery. In fact, most of our patients are back to doing their normal activities within a day or so. Over 250,000 patients worldwide have been treated with this long-term therapy, and well over 1,000 of my own patients have benefited from it themselves. This therapy has truly changed the way we treat bladder and bowel control problems.
I came to get my test procedure and I couldn't believe it. I didn't have to stop from Harrison to Patricia's house in Branson. I didn't have to stop and go to the restroom. I went from going sometimes 25 times a day to 5 times a day. So, I mean, this is going to give me my life back.
It's just the best thing going. And when we went, my friend and I went to the seminar that he first gave, and that's where we made our decision to try it because, like I say, I was bound and determined I wasn't going to go on any other kind of medication for it. And to not be able to have to do that is great. I can control when I feel I have to go, I can control it. I can hold it, you know, and I don't have the accidents anymore. And it's just been a godsend to me. I can definitely do my dishes now and turn the water on, and I can take a shower with water on without having any problems.
After this procedure, I could sleep through the night, I didn't have to worry, and it was immediate. And that is the greatest relief ever, the greatest feeling in the world, that it was immediate. All of a sudden, it's like my whole world changed. I not only felt better and had more confidence and looked forward to getting back to my old life, but I could do the things that I wanted to do and felt like I couldn't before, just knowing that I was going to be able to go 6 or 8 hours without having to go to the bathroom. I knew I was going to enjoy taking a walk or enjoy going for a hike, enjoy going to the park with my little girl. You can't even describe that feeling. Just all of a sudden, like the weight had been lifted. This will change your life.
I live in Mississippi, which is a 6-hour drive. Because of the procedure, it gave me my life back. I mean, I can drive, I can go get my groceries and my medicine, which I could not do. He's the most wonderful doctor I've ever met, and I've been a patient of Mayo Clinic since 2000. I've seen probably 100 doctors, and Dr. Taylor was the most wonderful doctor. I would recommend him to anybody. His office staff is superior.
When I first met him, his bedside manner was so beautiful. And he was so nice, and he put me at ease right away. As soon as I shook his hand, I knew that he was the one. He's a special person, and he put me at ease about the whole situation. Dr. Taylor's staff, those nurses, The only word I can come up with is awesome. They were sweet. They were really sweet ladies. They treated me very special. And now it's different as night and day. And I love it. It's the best thing that I could have ever done for myself.
I would not have had it done, the procedure done, if they hadn't have did the temporary first. That was what sold me on the whole thing, and I thank God every day that I did have it done. It's changed my life completely. Since I've had the procedure done, like I said, I can sleep 5 and 6 hours at a time now before I have to get up and go to the bathroom, which I haven't been able to do that in over 5 years, probably closer to 10, you know, so. And it was just getting worse and worse, so I would advise it for anyone that has a problem, truly. It's life-changing, it truly is. That I would recommend this to anybody, that it's been a godsend for me. So, but Dr. Taylor has changed my life.
I hope you enjoyed our presentation. If you have a bladder or bowel control problem and nothing else has helped, pick up the phone and call. I'm available for a free phone consultation to discuss your specific needs. Better yet, take that first step toward relief by scheduling a private in-office visit. We want to be a part of making life better. I hope to hear from you real soon.